all of you, since probably this is the first full week of the new year. And on such a cold and crisp January morning, it's heartening to see so many of you over here. It's a privilege to welcome you all to the Winter Dialogue on Responsible AI for Synergistic Excellence, RAISE 2026. The Winter Dialogue was born out of a simple but powerful intent to work collaboratively year after year through sustained dialogues rather than isolated conversations. It was envisioned as an annual platform that one builds a growing cohort of like-minded experts who deliberate together, learn from one another, and strengthen collective capacity over time. Our conversations around access, equity, and responsible innovation began around the World Health Summit regional meeting, which was held for the first time in India with NIMS University as primary host and Ashoka as a co-host. Over the past year, these conversations have matured into strong collaborative partnerships with national and international organizations as we collectively reflect on how responsible AI can shape healthcare at a moment when it is rapidly transforming health systems, research, and global cooperation. Today, together with our co-host NIMS University Jaipur, our technical host WHO-SEARO, and with the valued support of partners such as ICMR, NIDHDS, and Gates Foundation, we come together to formally begin these deliberations on responsible AI for Synergistic Excellence, RAISE 2026. The Winter Dialogue is conceived as a multi-city platform that convenes leaders from health, science, technology, policy, diplomacy, and industry to build shared understanding of how AI can be responsibly deployed to advance health equity and public benefit. Unfolding across Sonipat, New Delhi, Bangalore, and Hyderabad in January 2026, the dialogue leverages distinct strength of each city to connect diplomacy with policy, research with innovation, and innovation with scale. Alongside high-level panel discussions, the dialogue will also host a cross-site workshop on open validation and evaluation platforms for clinical AI tools, focusing on harmonized assessment frameworks and creation of a shared ecosystem for responsible AI in healthcare deployment. The dialogue opens today with Health AI Policy and Governance Edition at Ashoka University. This chapter will focus on national readiness for responsible AI in healthcare, exploring regulatory frameworks that balance innovation with safety, transparency, and accountability, as well as workforce and institutional capacity building to foster public trust. We'll look forward to the thoughtful discussions throughout the next 2 days. With that, we now formally begin the inaugural session of RAISE 2026. It is my honor to invite our distinguished leaders to join us to mark the formal opening. May I first invite the Dean Trivedi School of Biosciences, Professor Anurag Agrawal, to open the session.
Thank you all, and I would like to start by welcoming you all here. Definitely, it's a winter dialogue. You can feel the winter outside. And in fact, we were worried that given the way the weather was, we might be looking at an empty hall. So thank you for braving everything to be here today. I think, before I really start talking about this session, I really want to talk about why it is so important that we are having this kind of a dialogue at all. And if you look at the way AI has gone in the last few years, it's been absolutely miraculous. Very few of us sitting here could imagine 2 or 3 years ago what AI would be to become almost part of normal life. There's probably nobody in this room who hasn't used ChatGPT or any other tool. You also see the great amount of confidence with which the answers come, even when they're totally wrong when you happen to know the real answer. Now, health is such an important thing. If you don't have enough healthcare workforce, If you don't have enough access, inequity is terrible. The potential for a high-quality AI, increasing health equity, good quality access for everyone, is something that is almost priceless. In fact, in the World Health Summit, the regional edition that we held in 2025, I was going to say this year, then I forgot. Okay, fine, this was last year. This was the entire point. How do you scale access? And scaling access is something that India has probably done better than any other country in the world. So realizing the dual challenges of health being a very, very sensitive yet important topic where you need to scale but you can't afford errors, given the fact that in health the right answer is not inherently and obviously mathematically clear, it is contextual, it is based on circumstances. How can we use an error-prone technology, current generative AI, to deliver this? What is the governance framework? That's the resilience we are going to be talking about today. How do you create a system that leverages the power of modern AI, but builds the necessary guardrails to make sure that you do not destroy this powerful tool because of lack of trust in the community? And to do that, you really have to look beyond classical health workers and classical AI scientists. And that's the reason I think holding this in a university to start it off is so important. When you start talking to people who have been doing AI since before AI became, so common, people who have been using big data since before big data became the buzzword, you suddenly realize that you're talking to people who you never think of in the world of health AI. Professor Shoma Krochaudhary, who will be coming after me to tell you about the university, is an astronomer. And when the first time I was speaking to him, I realized that they've been dealing with data far bigger than what we call big data in health, decades before we even got started. They've been dealing with exactly the same problems of classifying images, using images, removing noise, and dealing with this in far more understandable and coherent ways, following proper theories of physics and maths that allow us to know what is the right answer, what is the wrong answer, far better than what we could. This is therefore the time when you need to look across disciplines, across sectors, borrow from people who used AI in ways that made things very less error prone. And here I'm going to put on a little bit of a scientific hat here. The reason you can use AI to make motion realistic is because you incorporate physics along with AI generated images. The equivalent things in health will somewhere have to incorporate physiology. You have to ground them in some kind of science that is not just pattern recognition. There is some reality, some truth that looks at everything that is coming out. How to do it is not something that doctors or computer scientists will be able to do alone. We'll have to learn from multiple disciplines. And then will come questions that are not answerable at all by pure science alone. What is the right thing to do? If you have two algorithms, one of which is 95% accurate, one is 90% accurate, but the one that is 95% accurate drops to 80% for women for some reason, and the other one that is less accurate maintains greater equity between men and women, what are you going to choose? There are no simple logical answers to these things. These are based on us as humans, what we define humanity to be, define what our goals are, and this is where the social sciences, the humanities, the way to think about fairness, none of which is the law of nature or the jungle, this is about us as society, become important. The philosophy and ethics are topics that will become increasingly important in the age of AI, not just in health but everywhere. So I thought it particularly important that when we open this and we talk about policy and governance, we look at it in a place that brings together many of you from multiple different backgrounds. Some of you have been at the front lines of health systems, who understand what failure could mean. Some of you come from the deepest part of science, who understand how to reduce the risk of failures. And all of you are committed towards advancing the vision of health access and equity through AI. Ultimately, it's AI for health, not health to advance AI science. And that, I think, is the reason we are all here today. And the spirit of this, I believe, is very much captured by the spirit in which this university was founded. I welcome you all to it, but I leave the deeper welcome to effectively my boss, the Vice Chancellor, Professor Shomak Roy Chaudhary, who is the physicist I was referring to, who taught me that a lot of what we do right now in biology has already been done by them before. But Shomak, over to you.
Thanks, Anurag. Good morning, everybody. When Anurag said that this meeting was going to start at 9, initially that was the plan. And I looked outside my window and saw that even at 11, I couldn't see the neighboring building. The smog in Delhi is rather intimidating. Today is a much better day. And I'm glad we could start off at a reasonable hour where everybody's around. Thank you very much for coming. It's a very, very important meeting for us. Ashoka is, I'll tell you a little bit about the university where we are holding this and why it is very important that we have this meeting here at Ashoka for us as well. We are only 11 years old. Ashoka started off as kind of a new generation Indian university in the private space. Of course, most Indian universities till a couple of decades ago were either federal or state universities. They are government-funded universities. Private institutions in the higher education sector essentially have taken off in the last couple of decades and now outnumber the public sector institutions. But even in the private university space, most universities are professional universities. They're universities that concentrate on the technological parts, engineering, and medical, or their management schools or law schools. Ashoka and a few other universities started off about a decade ago in the liberal arts space, looking at the core sciences, humanities, social sciences. Ashoka was essentially started off with a bunch of humanities and social science departments. With the sciences joining later on. We do not have the professional schools on campus. However, we have very active departments that border on subjects that are often dealt with in professional schools. The undergraduate population of Ashoka, over 3,000 of them, live on campus. And we are set up in a truly interdisciplinary manner where we don't have buildings that map into departments. The students come in, undergraduates come into Ashoka not declaring their major till their third semester. They all study a common pool of courses from foundation courses, which is very much the old liberal arts concept. Students, everybody has to take courses on critical thinking, the great books, literature in the world, principles of science, quantitative reasoning, mind and behavior, Indian civilizations, things like that. And these are taught by some of our best faculty. And then they move on to then choosing their subjects. And this is a revolution in India in terms of how students choose their major at university, not being pushed into a particular commitment right at the beginning as they join the university. This also provides very interesting aspects of governance for us. Of course, we are inherently looking at students who will do various things as they move through the university and get a taste of various subjects, and people do. But we have to also make sure that they, move towards career paths that are feasible for them, and that does happen. I mean, almost 100% of Ashoka students end up in a job. 30% go into higher education. The others are gainfully employed, and we have to look at building skills amongst the students, which are valued as they transition out of the system. This means that as we build Ashoka, into a research active university, which is also a new thing in India. Universities traditionally don't do research in India, but we are a 100% research university in terms of the fact that we have a tenure track for our faculty. Faculty have to prove their research in order to become tenured. So the university puts equal amount of emphasis on the teaching part, the research part. This is where meetings like this become important. Our commitment to interdisciplinary meetings become important. Even though we don't have the professional schools, we have a very active computer science department, which looks at the basics of computer science, the theoretical aspects of computer science, more than the practical aspects of computer science. And this is why, with the AI revolution, the data sciences and AI/ML became such an important subject for us. And similarly, in our School of Biosciences, and Anurag very elegantly pointed out, we do quite a lot of research in the health sciences, even though we don't have a medical school. Both Anurag, as the Dean of Biosciences and a head of biology, are medical doctors, and we have very active medical focused centers. Of course, the Koita Centre for Digital Health, which is the centerpiece of the organization here, but also the chart where Purnima, I can see her across here, and various other centers look at the interaction with public health with various other things. Now, it's very, very, of course, important for us that the data sciences and the health aspects of our research come together. They interact in very important ways, but in much more than just interacting between these two areas, because it is embedded in a liberal arts university. So as soon as we started focusing on areas to do with AI, the aspects that our humanities departments are interested in became very important. The ethics of AI, the philosophy of AI, and the interaction of AI with economics, agriculture, public policy became very important. And these are very interesting ways in which research at Ashoka progresses by looking at these overlap areas. And this translates directly into our teaching, because we now have a 4-year system, 4-year undergraduate system, in which research plays a very important role even in undergraduate education. Our undergraduate students get involved in various research projects in groups or individually, and they see resources drawn from various departments. So Anurag pointed out, I mean, I am a physicist, I'm an astrophysicist. I started working in AI/ML 3 decades ago. And in fact, my very first project involved a cognitive scientist, a medical doctor, a computer scientist, and an astronomer. And that's because inherently, when I looked at how people look at EEGs and try to understand underlying brain patterns, it's very similar to, mathematically, exactly similar to a black hole system in the middle of a galaxy, and how the X-ray observations of a supermassive black hole manifests itself in a very short-term variability. And by looking at essentially time series, you try to find out how, in a non-parametric way, you can infer underlying models of how these radiative patterns are generated. So actually, the domain knowledge is separated from the method that one uses in techniques, and this now has come to a huge focus by looking at when people are trying to apply AI in these various fields. Responsible AI is the theme, and there, as I said, the main concerns are how people use responsibly the various AI tools that are rapidly now taking over so much of the educational space all over the world, and particularly in India. This is, I hope, something that we'll discuss over the next few days. Going up to the AI summit, of course, that's going to happen in a month's time. where a lot of people from all over the world will come together. So this is a wonderful occasion for the university, and as a representative of the university, I welcome you here, and I'm very looking forward to the rest of the couple of days. Thank you very much.
And then it is up to Aradhita.
Thank you, Professor Somak, for setting the vision. With that, I would like to request Dr. Karthik Adapa, Regional Advisor, Digital Health and AI, WHO-SEARO, to kindly share your.
Good morning, colleagues and friends. It's an absolute pleasure to be here. My name is Karthik. I'm the Regional Advisor for Digital Health in the World Health Organization. So the first question that some of you might have is, why is the World Health Organization in a private university in India? I'll try and address the demons in the room. I came here about 2 years back in early February 2024, and it's been a very learning experience coming here. And what Professor Somak talked about, the importance of research, that essentially was one of the major drivers to bring the World Health Organization to Ashoka University. I met Anurag about 2 years back, and since then it's been a wonderful collaboration, to say the least. One of the most important gaps that we've had in the region was that we did not have a single WHO collaborating center for digital health and AI. And so amongst the various universities that are there in the country, Ashoka stood out as a very interesting example where they bring in interdisciplinary research. And so for us, we felt at WHO, Ashoka University could potentially be the first ever WHO collaborating center for digital health and AI. And amongst the variety of partners that you see here, ICMR is, of course, a prospective WHO collaborating center. So is IntelliHealth, but one of the primary organizations that actually is leading to become designated as a WHO collaborating center for digital health and AI is Ashoka University. And that's one of the primary reasons why, as WHO, as a scientific and a technical organization, we've been interested at promoting not just the science and the methodology on how do you drive health AI, but also get more of an interdisciplinary research. And that is the primary reason why we've been trying to look at a variety of partners. The second major reason is, as we think about health AI, as what Anurag very nicely elucidated, it does not just become only for public health researchers or physicians or just computer scientists to work alone, but bring in a variety of other experts as well. So if all of you are here so early in the morning representing variety of disciplines, that is predominantly the reason why, as WHO, which kind of drives more the international health, more standards and normative work in AI in health, also in digital health, the science of how do we do this and how do we really scale AI, improve access, make AI safe, and therefore, over these next 2 days, WHO is essentially put in about 6 sessions, which are all carefully curated. We have some of the leading scientists, practitioners, and public health researchers who are going to present some of the work. So we've got 6 broad sessions here, where the emphasis is more on the science, on how do you really take AI, make it equitable, improve access, and also make it safe. So on these lines, what we're hoping is that this dialogue would lead into good technical briefs and technical guidance to not just India, but also the entire region. So firstly, thank you again for being here. Thank you to the speakers who've taken the time to travel from around the world to be here. You will hear a variety of conversations, and we hope this is great space for you to engage in a very fruitful discussion. So thank you again so much, and thank you to Ashoka and all the other partners for hosting this dialogue. Thank you all.
Thank you, Dr. Karthik. Next, it is my pleasure to invite Dr. Sanjay Patanshetty from NIMS University to address the gathering and reflect on the collaborative ideas behind this and to close the inaugural session.
Good morning. There's a nice African proverb which says, I think I should stand like this, otherwise I'm not visible. Good, this mic can move. you'll know your real speed when tiger chases you. So now, if you see AI as the tiger, we really have to get up. But one thing stood really different. What Anurag sir explained, especially when we did World Health Summit regional meeting, is the same motto was there. You're doing it for the first time. Uh, but what we did, it's life. You don't have to figure it out. You just have to climb on the beast and ride. You can't escape the challenges. But what role an university can play? That's extremely critical. And what led to this rise dialogue is universities are generally stood as evidence disseminators because we do education, evidence creators because we do research. But what is more needed is the dialogues like this in the university settings, because you need to work on evidence translation, influence the policy translation. So how do we train our students, next generation, to stand and say, yes, I'm going to face this challenge. I'm going to work on this to see how a translation can be brought in. So I think we are extremely happy from NIMS University, collaboration with Koita Centre for Digital Health, Ashoka University. Thank you, sir, Vice Chancellor, who is here, and Dr. Karthik, and all others. Aradhita been excellent. I think he's a partner in crime hosting this entire organization. But what is most important to close this is, I really like the Olympic motto. It talks about faster, higher, stronger. But in 2021, something was added, is solidarity, together. See, if we are not together, how much ever you do faster, higher, stronger, you'll not win. So together, intersectorality, multisectoral collaboration, I think is extremely critical. And this forum, RISE, which is set as an annual event, I think will definitely bring more and more stakeholders, will create a momentum for a meaningful change. So let's rise against the challenges and face it boldly. Thank you so much.
With that, we come to the close of our inaugural session. I would like to thank all our leadership to having come here and share their vision. As a small token of appreciation, we would like to present mementos to the leadership. May I request Professor Anurag to please present the mementos? By and by, somebody reminded me down there that in all the excitement of inaugural session, I forgot to introduce myself. I am Aradhita Baral, the Deputy Director at Koita Centre for Digital Health at Ashoka University. Group photograph, please. Yeah. Thank you so much. And moving on to the first panel, but before that, I'd request the participants of the Validatathon workshop to please proceed to room number 207 in this building. This is on the second floor. And now for the first panel, over to Girish.